Welcome back, everyone. For those of you who are just joining, my name is Tina Costa, and I'm one of the directors with the Office of Virtual Health here at PHSA. I'll continue to be your host during the virtual sessions, and it's my pleasure to welcome or re-welcome you to the 2023 BC Digital Health Forum, inspired by Canada Health InfoWay's Digital Health Week. For those of you just joining our virtual circle, we encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. May we all take pause to honor their connection to this land and their stewardship in caring for and nurturing these lands for all time. Let us also give thanks for the opportunity to gather, learn, collaborate, and provide care on these beautiful lands. I now have the pleasure of providing a condensed introduction to our next two presenters, Dr. Amina and Dr. Hamid. Dr. Amina is an expert medical scientist and healthcare entrepreneur. She brings a wealth of experience in clinical lifestyle management of diabetes and related diseases. Her educational journey encompasses PharmD and a PhD in clinical nutrition from the University of Nottingham in the UK. Hamid and Amina have now brought their extensive experiences together to create a digital platform combining life coaching with digital techs, including AI, to provide scalable diabetes prevention and reversal programs, resulting in better health in the community setting. Dr. Hamid is a physician scientist, healthcare entrepreneur, and esteemed academic. He has advanced the field of diabetes and obesity medicine by incorporating cutting-edge lifestyle sciences into practice. His impressive educational journey includes an MD, a PhD in clinical nutrition and metabolism, and clinical fellowship in diabetes and endocrinology from the University of Nottingham, UK. Currently an associate professor with honors, he continues to excel in academia. Please join me in welcoming Dr. Amina and Dr. Hamid for their talk on D2Type, empowering lives with an innovative app to tackle type 2 diabetes. Welcome.
Thank you so much. Good afternoon, everyone. I'm Amina, co-founder of D2Type, alongside our CEO, Hamid. We are excited to be here at BC Digital Health Forum and extend our gratitude to our host for invitation. This opportunity allows us to share our vision at D2Type. At D2Type, our mission is to create a positive impact on the life of those with pre-diabetes or diabetes. We leverage digital technology, including AI, to prevent, delay, and reverse diabetes. Our passion lies in delivering cost-effective solutions for employers, health plan, and healthcare, ultimately improving diabetes management and enhancing quality of life. Thank you, and I will start sharing my presentation. I acknowledge that my place of work is within the unceded territory of Musqueam, Slovada, Squamish nations. You may know 1/3 of people have diabetes or pre-diabetes, causing significant health and quality of life challenges. Unfortunately, current medical approaches have failed to tackle this crisis. That's why we at D2Type develop a mobile app to combine digital technology, including AI, with life coaching to empower at-risk individuals to prevent and reverse type 2 diabetes. Unlike other companies in the field, D2Type provide comprehensive service based on our extensive experience in managing diabetes. Our approach focuses on making even modest lifestyle changes that can have big health impact. We believe in providing services that are not only effective, but also desirable and personalized to individual needs. We together have over 30 years of experience, especially in building a solution that can save lives by managing diabetes. Our solution has been confirmed by clinical study in over 75,000 patients. Our track record of success in diabetes management in clinical settings is impressive, with 94% customer satisfaction rate and 88% engagement rate. And now we are bringing all that experience to D2Type. To accelerate D2Type's growth, we have surrounded our management team with highly experienced consultants and diverse and talented team members working in various aspects. Did you know 1 in 3 individuals have some form of diabetes, which means 11.7 million in Canada and 130 million in the US are at risk? Sadly, over 20 Canadian and more than 280 Americans lose their lives every day due to diabetes and its complications. Over $30 billion are spent on diabetes management by Canadian healthcare and employers. Diabetes healthcare expenses in the US is the highest with almost $380 billion. Despite these shocking numbers, current medical services have been unable to address this growing crisis. Diabetes prevention and reversal lifestyle programs are in high demand in Canada. To our knowledge, no practical diabetes prevention programs are currently available. Only a few pilot programs have been launched recently in Canada, and the results are still yet to be published. Their approaches are more traditional and not scalable. Now, people being diagnosed with diabetes is referred to attend a lifestyle class to learn the basic diabetes self-management. Then they will come to their family physician when they need to refill medication or lab test order. While current guidelines indicate that lifestyle modification is the basic of diabetes management, a lack of comprehensive lifestyle management program are clearly seen in the healthcare services. It's time for launching a comprehensive and accessible approach to tackle the problem. At D2Type, our innovation focuses on using cutting-edge technology to bridge the gap between medical and life sciences, transforming them into practice. Through integrating digital technology, we develop a scalable service that empower individuals at risk for diabetes to manage their condition effectively. However, combining these 3 distinct ecosystems present unique challenges, each with its own set of approaches. Addressing these challenges is crucial as we strive to seamlessly integrate these services into actual practice. D2Type offers a personalized health coaching and using digital tech in monitoring lifestyle metrics. With the power of AI, our platform can predict the likelihood of diabetes and give recommendations based on individual needs. Our digital platform combines the latest in life coaching with cutting-edge technology, including AI, to help participants track key lifestyle metrics such as eating behavior, physical activity, stress level, and sleep pattern. With regular feedback and access to interactive lessons, peer groups, and gamification, our program is designed to keep participants motivated and engaged. Our several clinical studies have validated the component of our services. Plus, we offer our services in different languages to make it accessible to wider audience. To make it easy for users to develop healthy habits, we use mobile app. Our mobile app has been designed for users in iOS, Android, and PW. Regarding the value proposition for participants by achieving a moderate weight loss of approximately 5 to 7% of initial body weight, the risk of diabetes can be reduced by 60%. For employers, D2Type offers a cost-effective program that empowers at-risk employees to manage diabetes, leading to increased productivity and reduced healthcare costs with a return on investment in less than 1 year. And for healthcare system, is estimated to save $20 billion over 7 years with an investment of $150 million. As shown in this slide, our initial product was ready in July. We ran our beta testing during the summer, and now we will run our paid pilot for BC Ministry of Health for 3 months until first quarter of 2024. Then we will be ready to launch our feed market product to potential customers. To summarize, we aim to apply our long-standing experience to the community setting, so every patient around the world can benefit from it before we lose another life. Thank you, everyone. Your presence during the presentation means a lot. Let's acknowledge that our combined effort today contribute to a healthier and happier future. Together, we have the power to leverage technology, transform healthcare, and improve patients' experience for a better quality of life. Feel free to stay in touch beyond this forum, fostering collaboration and innovation. Together, we can build a strong, patient-centric digital health ecosystem for everyone's benefit. At the end, we are inviting anyone with pre-diabetes or diabetes who is interested in participating in our free pilot program, which is supported by BC Ministry of Health, to email us. Your engagement is really appreciated. Thank you so much.
Amazing. Thank you so much, Dr. Amina and Dr. Hamid. I'm really just impressed by the demonstration and positive impact that you're sharing around personalizing healthcare experiences to really improve that patient empowerment aspect. And as we know, the impact that that then makes not only on how people feel about their healthcare experience, but the true benefits and clinical outcomes that that brings to their care. We do have some time for Q&As. If anyone does have some questions, I believe there might have been a few. I don't see them in the Q&A section, but I'll just hold for a minute to see if anyone would like to put a question into the Q&A chat. People might be typing, so I'm just going to give it a moment, but definitely wanted to call your attention to just the emojis that sometimes you don't see them come up from the bottom of the screen, but there sure was a lot of celebration to the presentation. A few more there now. Do see one question coming up. Someone is wondering if we can see the email context once again. And so if we could, I'm not sure, Amina, if you're able to pull up that slide, that would be great. And while you're doing that, maybe, I'm not sure, Dr. Hamid, if you would like to answer this question. Question is, can you explain the study that you mentioned with the Ministry of Health?
Hello, everyone. Thank you so much for inviting us. Actually, the pilot that we are going to run, it's going to be to start hopefully in the next 2 weeks. And we are going to invite anyone that's suffering from type 2 diabetes or at pre-diabetes level, or the healthcare provider. We are going to communicate with the healthcare provider to introduce anybody at risk. It means that people suffering from metabolic syndromes are going to introduce or refer to our program. And once they log into the program, we have just a digital toolkit, and based on that, we can measure or detect who are going to be moderate to high risk. But as a first aid for managing type 2 diabetes, we are including only people not at the end stage. People are at earlier stage with type 2 diabetes or at pre-diabetes level or at risk for pre-diabetes are invited to continue and to attend the program. Our program should be for 1 year, but our pilot should be for 3 months. During the 3 months, we are going to have to set the personalized targets for the people based on the information that we are gathering from their lifestyle. And then we are going to make partnership with them, make the combination of life coaching with digital tech. And our main objective for 3 months pilot should be reconfirm the effectiveness and the feasibility of our product. Although that, as Amina explained in her pitch, that we have this experience for more than 20 years in a clinical setting in person and in virtually. We have produced our own evidence that is published in prestigious journals, mostly in the US journals, in the different features that we are collecting in our app. It means that we have published clinical trials for managing metabolic syndrome, obesity, and diabetes for physical activity, eating behavior, stress and mood, and also for sleep patterns and for food choices. We put all these features together in this mobile app to make it more accessible and more scalable.
Incredible. I see a follow-up question, Hamid. Do potential program participants need to be located within BC?
We are actually, based on our agreement, they should be the residents of BC. But after this trial, we have communication with the other healthcare authorities to start or to expand our services. Actually, our segment market or business model should be two parts. One, we are going to provide these services through the partnership with the private insurance to implement in their health benefit package. And also we understood that large size companies are interested to have our program implementing in their well-being packages. But our ultimate goal in Canada should be putting this or implementing our program to the MSP services to make it more accessible for people at risk. In Canada only, more than 11.7 million suffering from diabetes or pre-diabetes. And we have just the lack of resources for the health in the healthcare system. And it is the sense that we provide these services and we want to use the digital tech to make it more equitable services for the people at risk.
Great. I think the audience is really following the flow of this presentation. The next question that they've presented is really, first of all, thank you for a great talk and study. It's some really exciting stuff to learn about as you guys move forward. Question is, would you have any thoughts on how equity deserving groups might be recruited or how they might become engaged, thinking about patients who may not have a smartphone or access to Wi-Fi and or lack of the skills needed to use technologies?
Actually, it is something that any program needs some pre-requirement. But as we know, and nobody can believe that people, even elderly people, there is some evidence that more than 72% of the people, even at elderly stage, are using mobile app. And they are interested to have their health services through the digital technologies. We appreciate that there is three things or three barriers or three challenges for providing digital health services. First one is engaging. The second one is commitment to the program. And more importantly, should be the sustainability of the impact. It means that people already being diagnosed or being diagnosed with type 2 diabetes or any chronic disease, at the earliest stage, they are very motivated to manage their lifestyle because they are too scared about their future. But in the reality, it is very difficult to continue this program. And it is the things that we, based on our experience, it is not the diet program. It is not the weight loss program, although that one of our targets should be losing their weight, but not as ideal weight. We are going to make modest, gradual lifestyle changes, but it is some requirement based on, in response to your questions, it is necessary that anybody have just the basic knowledge for using app in the mobile. And it is the only solution that we make scalable, and also accessible for people living in the remote area or involved with their busiest life schedule that they have.
Thank you. Just wanted to see if there is anything else yourself, Hamid or Amina, would like to add. Otherwise, there aren't any other questions. I'll just open the floor one last time to the both of you.
I want just to thank you again for inviting us, and very welcome to, because although that we have run in the clinical setting for a long period of time, but we are at the earliest stage to use the digital tech, including AI. AI is not going to replace for the health professional. It's going to help the health professional to make them more engaged with the patients and having more data from the patients. It's not going to replace the healthcare services. And we are very passionate about having their comments, anybody involved in anybody in the healthcare stakeholders, to help us to make it improve and helping people at least to have better quality of life and better diabetes management.
Thank you so much. Amina.
Thank you so much for having us. It was a pleasure to be here. Thank you.
Thank you. Really our pleasure to hear about your work. I want to thank you both for your presentation today, but truly the commitment and advocacy that you're showing for our patients and families. Really appreciate it. Lots of more appreciation, and we'll say thank you one last time. We are going to close here, and as you may have seen in the previous session, we'll deploy a short poll again to gather your feedback on the session. As you're completing that poll, we'll then invite you to our next session, which is on establishing a virtual and digital health innovation hub at BC Mental Health Substance Use Services. Again, you can navigate to the next presentation using the panel on the left-hand side of your feed loop screen, and I look forward to seeing you all there. Appreciate your time.